Yes.
Yes.
Okay, perfect. Wonderful. Well, hi everyone. I'm Anae Evangelista. I am the Community Impact Manager for the San Diego Hunger Coalition. And I'm going to talk a little bit about some recent updates we've heard from CDSS regarding the HR1 Federal Budget Reconciliation Bill, which is going to bring about a lot of large changes to the CalFresh program. A lot of these changes are going to be taking place early in this first half of 2026. And some of the information I'm going to be going over is going to look kind of familiar, especially if you've attended some of our previous trainings on it, or if you attended our annual event at the end of last year. But there has been a good amount of new updates from CDSS, the California Department of Social Services. So we just wanted to share those and talk a little bit, more about what we can kind of expect as some of these new rules and policies, come into play. All right. So before I do talk about the changes from the budget reconciliation bill, I do just want to, first of all, just start with some context behind why it's important for us to really consider these changes and who exactly, this reconciliation bill is going to be impacting here in our county. So first of all, of course, we know it is going to impact those who are nutrition insecure. And you are considered nutrition insecure if you are unable to purchase 3 healthy, nutritious meals a day. And I do just want to differentiate nutrition insecurity from food insecurity. At the Hunger Coalition, we specifically use nutrition insecurity because we want to measure people's ability to access nutritious meals, right? Families might be able to afford cheap foods like ramen, cheaper foods, like junk foods, but we want to make sure that they're able to also access nutritious foods because it's really important to make sure to, avoid poor health outcomes and, avoid things like healthcare, like, Dr. Chen was talking about. And so in order to be considered nutrition insecure, families do have to be making income below 200% of the federal poverty level. And as you can see on the slide here, varies based on household size. But to just give you an idea, for a family of 4, for example, they would be considered nutrition insecure here in San Diego if their total yearly income was at or under around 64,000 a year. And unfortunately, nutrition insecurity in our county has been on the rise since the pandemic. More than 1 in 4 people in our county are now considered nutrition insecure. So this is the highest we've seen it again since COVID, since pandemic times. So again, this means that these people and their families are not able to access 3 nutritious meals a day. And unfortunately, it does impact a lot of our more vulnerable populations, right? It really impacts children at a high rate. Nearly 1 in 3 children in San Diego are considered nutrition insecure. Impacts, older adults as well, those 60 plus, more than 1 in 4 are nutrition insecure. And for those with disabilities, it impacts them at about a 37% rate, right? So you can see here, these are a lot of our most vulnerable populations who are impacted by nutrition insecurity and thus who are going to be impacted by some of these changes that the reconciliation bill is going to be bringing about. And so the federal budget reconciliation bill, again, some of this might look familiar to some of you, especially since we've done a lot of presentations on it in the past year. But this bill was signed into law in July of last year. But some of the changes it is bringing are officially going to start to be enforced in the first half of 2026. And one of the biggest changes I just want to first highlight is the change to immigrant eligibility for CalFresh. CalFresh, as many of you know, is a federal food nutrition program that people can use to access food benefits. And unfortunately, it is going to be quite limited starting April 1st, 2026. So many immigrants are going to be losing their eligibility for CalFresh starting April. Once we reach that date, the only individuals who are going to remain eligible for CalFresh are going to include citizens, legal permanent residents, green card holders, people who are granted Cuban or Haitian status, And lastly, people who are citizens of the Federated States of Micronesia, Marshall Islands, and the Republic of Palau who live in the US. And so this does mean that a number of immigrants who are currently eligible are going to be losing access to CalFresh starting April. So this includes immigrants like refugees, unfortunately, asylees, non-citizens who have had deportation withheld, survivors of domestic violence, so U visa applicants and U visa holders, and survivors of human trafficking or other serious crimes, so T visa holders.
Mm.
So I do just want to note again, unfortunately, these individuals are currently eligible for CalFresh, but come April, they are going to be losing access to their benefits. But there are a few key things to note for this change that CDSS has alerted us about. Currently, immigrants who are currently eligible, they can continue to receive benefits after April if they, again, are currently on CalFresh. And they can continue to receive benefits until their recertification or their renewal of benefits is due. So this does mean if you have an immigrant family who's on CalFresh, like a refugee family, for example, if they are currently on CalFresh come April, they can continue to keep their benefits until their renewal. So it is going to be a bit of a buffer period that they can keep their benefits. Unfortunately, once the renewal is due, their benefits will stop then. But again, they will continue after April. And we do want to note as well that CDSS does not expect families to self-report if they have lost eligibility due to immigration status. Again, they can continue to receive benefits until their recertification is due. And I do just want to note that recertifications or renewals are typically 6 months after you initially applied or after you last renewed your benefits. And then any new applications after April 1st are going to be subject to new immigrant eligibility rules. So if you are part of the immigrant list that is losing eligibility, you unfortunately after April will not be able to get access to these food stamps, these food benefits. And knowing this does mean that outreach to eligible immigrant families is going to be extremely vital in these next few months before April. So on the last slide, I noted, come April, immigrants are going to be losing a lot of their eligibility for the CalFresh program, but they can continue to receive their benefits if they are still on CalFresh until their renewal. And I do just want to note, CalFresh does not count on a public charge test, and it will not affect the immigration status of the applicant or the applicant's family. So currently, CalFresh is still safe for immigrants to access. I do just want to be transparent though, because I know it is a large concern for a lot of families. In December of last year, the Trump administration did state that they are trying to change the current public charge rules to include CalFresh as a public charge. Nothing has officially changed as of yet. So again, it is still safe for families to access. And so it is just really vital for us to do some outreach to families, let them know it's important to apply for and use these benefits while they're still eligible and while CalFresh is still not counted on a public charge test. And if anything does happen to change, if any policy does happen to officially get pushed, we will be sure to let all of you know. We always update our social media, and you can always reach out to us if you ever hear or have any questions as well. Next change that I just wanted to go over is the ABOD rule changes that are going to be coming. So ABOD stands for able-bodied adults without dependents, and it is a federal rule that is in place. It limits the amount of time that people can access CalFresh benefits to a maximum of 3 months in a 3-year period if they do not work or if they do not meet any exemptions. So originally, a lot of states, including California, had a waiver to this rule, and we had this waiver since the pandemic. It did come to a premature end as of last year. In California, specifically here in San Diego County, we have lost our ability to renew the waiver. You must have an employment rate above 10% to renew it, and San Diego is quite below that for reference. But unfortunately, the criteria for who has to follow ABOD rules is going to be changing, and it's going to affect a larger amount of people. So with current ABOD rules, currently people who are experiencing homelessness, individuals who have aged out of foster care, who are under the age of 24, and veterans, under the current rules, they have work requirement exemption. So this means they don't have to be working in order to receive CalFresh. They're not subject to that time limit. Come June, unfortunately, these work requirement exemptions for the people I just listed, they are going to be eliminated. So this means that these individuals do have to be working, otherwise they face losing their benefits. This is really going to affect a lot of people, especially those experiencing homelessness. It is not easy to find a job. Of course, the unemployment rate is still quite high here in San Diego, even though it isn't high enough to qualify for the waiver. It really isn't easy for folks. And so we are going to see a large amount of people lose access to their CalFresh benefits, come June. There is going to be a work requirement exemption added for individuals who are Indians, urban Indians, California Indians, and other ones who are eligible for Indian Health Services. But again, these ABOD rules are still going to continue to expand. The ABOD rules are also going to expand to include people ages 18 to 64 instead of those aged 18 to 54. So this does mean some older adults who currently are not subject to ABOD rules, those between the 55 to 64 age range, they are going to be expected to meet work requirements or have a work exemption if they want to continue receiving benefits. And this work limit is going to also expand to include families with children age 14 or older. So even if families have dependent children, they are going to be expected to follow ABOD work requirements if their child is age 14 or older. And this applies, even if you have a working parent and a stay-at-home parent, both parents are going to have to meet work exemptions if they want to continue to receive CalFresh benefits. And so I noted this earlier, but these ABOD rules are going to go into effect starting June 1st of 2026. Those who are affected by these ABOD rules can continue to receive benefits normally until their recertification is due. So if you don't happen to meet work requirements or have an exemption, that 3-month time limit that I mentioned earlier will begin once your benefits have been recertified. And then any new applications after June 1st, if you aren't already on CalFresh, they are going to be subject to ABOD rules. So that 3-month time limit is going to begin then starting June. And I do want to note, these are going to be some of the biggest changes that are going to be coming in these few upcoming months. CDSS, the California Department of Social Services, is preparing a lot of outreach material to inform CalFresh families, to inform households, and to, of course, prep organizations who work with the community on these changes and how it is going to be implemented in our county. They are working on informational flyers to be mailed to CalFresh households, social media templates, and additionally, they will have a frequently asked questions page as well. They did state that a lot of this outreach material will be available likely a month before the rules officially start to be enforced. So the immigrant outreach material will likely be available starting in March, and all of the ABOD work requirements outreach material will likely be available starting in May. Oh, and I do see a question in the chat. Is the navigator training incorporating these updates? Yes, so we are continuing to update our navigator training. We actually do plan to host specialty trainings that go a little bit more into detail in around March. We will be setting up the Zoom links and adding it to our website and, of course, also our social media. So we will be hosting some specialty trainings then, and we can be sure to invite all of you. Another important thing I just wanted to share is with the federal budget reconciliation bill, it does expect states with a high error rate for CalFresh to pay a portion of the CalFresh benefit. And this does mean that beginning in 2028, California may be expected to pay up to 2.1 billion annually if we don't get our error rate down. And as you can see, 2.1 billion is a lot of money, and it is going to be a really heavy burden on our state's budget. We definitely don't have that 2.1 billion to allocate towards CalFresh benefits. It's going to be very hard for the state to make that up. And so it may lead to a reallocation of the budget from other important resources. So it's going to be really important to try to help the county keep error rates down. So if you happen to work with any households who are currently on CalFresh, it is very important to encourage them to report any changes that have occurred as soon as possible to minimize the chance of an error occurring with their CalFresh application or with their CalFresh benefits. And changes can include things like income changes, changes to your expenses, your rent, your medical expenses, household changes. So if someone is born into your family, if you have a college student, maybe leave your family. Any and all changes should be reported to the county right away. You can do it pretty easily by calling the county access line. You can also report the change on Benefits Cal. You can do it if you have an account, but you don't necessarily need one on that website. There will just be an option for you to go ahead and upload that change. There's going to be an upload document button on the website. You would just need your case number. Of course, with that, because of the changes coming to SNAP, I do just want to take a little bit of time to highlight other food resources that are available here in San Diego. So, of course, we have some of the big ones listed here, including WIC, Sunbucks, Meals for Older Adults, and Food Distributions. So, first of all, spotlighting WIC. WIC stands for Women, Infants, and Children, and it is a federally funded nutrition program that provides food. It provides support for low-income pregnant individuals, those who are postpartum and breastfeeding, and their infants and children up to the age of 5. So WIC does provide cash benefits that they can use to purchase approved healthy foods, foods that are tailored to nutritional needs during pregnancy, infancy, and early childhood. WIC also provides nutrition information and educational classes, so it does include things like healthy eating habits and learning infant feeding cues. And lastly, they do also provide breastfeeding support, including lactation peer support, individual and group sessions, and access to lactation consultants. And I do want to note as well, unlike CalFresh, WIC does not count military housing stipends as income. So it is oftentimes easier for military families to be approved for WIC versus CalFresh. One thing I really want to note as well is that although WIC has offices and organizations who provide WIC appointments available all over San Diego, they oftentimes do also provide appointments over the phone as well. I know it has been a very big concern as of late due to ICE raids, due to immigration arrests. A lot of times people are scared to go out and actually go in person to access these services. They don't actually have to go in person. A lot of this can be done over the phone. And you can very easily find, your closest WIC office by going to stwic.com. And one big thing I wanted to note as well is that immigration status does not affect eligibility for WIC, unlike CalFresh. So you don't have to be a citizen or of a certain immigration status in order to access WIC benefits.
Entonces no necesitan ser.
And I do see a question in the chat. Could applying for CalFresh when someone is no longer eligible be considered an error that the state would be penalized for? So it wouldn't be considered an error unless they get approved when they shouldn't have been. You can always, of course, try to apply for CalFresh. Even if you're not sure if you're eligible, it doesn't hurt you to apply. However, it would only count as an error if the county incorrectly approves it. And yes, thank you, Naomi. WIC does provide again cash benefits for certain approved healthy foods. All right. Next program we have here is Sunbucks or Summer EBT, as some of you may know it as. It is a federal program that aims to bridge the health gap, the hunger gap during summer when students lose access to free school meals. Each eligible child in a family is going to receive $120 worth of grocery benefits. And families who are on CalFresh are automatically certified for the Sunbucks program. So it is a really great program for families that have children in school. They are still currently sending out Sunbucks cards for 2025. So if you are working with any families who should have been eligible but haven't received their card yet, we do recommend that you have them call the Sunbucks helpline as soon as possible to get access to their card. Additionally, as well, people can start to actually apply for summer EBT benefits for 2026. And again, if you'd like to find out if you are eligible or likely eligible, the Sunbucks helpline can help you at any time. And another big thing to note is that, again, immigration status also does not affect eligibility for this program, just like WIC. For those working with older adults, one resource I just want to highlight is congregate meals. Different providers provide free meals for anyone age 60 or older. Immigration status, again, does not affect eligibility. The HHSA Aging and Independent Services website has a list of providers that have congregate meals. Just for example, one organization like Serving Seniors has several congregate meal sites available throughout San Diego County. There are several options for home delivered meals as well. For example, medically tailored meals. Those who are on Medi-Cal with a qualifying medical condition may also qualify for free home delivered meals. There are several organizations who can connect you with that. They can provide you with up to 3 nutritious meals a day for those who qualify. And again, this can be delivered to your home. For example, Mama's Kitchen is a really great organization who does this work. And we have added, of course, their website where you can get connected with them here. And then, of course, lastly, I just wanted to highlight the food distributions. The San Diego Food Bank and Feeding San Diego do amazing work in setting up food distributions across the county. They have in-person distributions and even drive-through distributions that are available. They have maps where you can very easily see where your closest distribution is, and you can filter through the maps to see certain days that distributions will be open. It makes it very easy again to find one that is close to you. I did go over all of these resources very briefly, but we could definitely go way more into depth. I know we just don't have enough time for that. So if you'd like to learn more, we do have food assistance flyers that go over we go over information for all of these programs, including links and numbers if you'd like to connect. This flyer is available in 13 different languages on our website. So if you are interested, please feel free to check it out. We do host monthly trainings as well, including a training specifically for CalFresh and our Hunger Free Navigator training, which covers all of the different food programs. And we do have them linked here. I'm not sure if Gabriel, if you might be able to maybe share my slides with the group later. just so we can send out all of the links later. But that is the end of my presentation. So I will go ahead and I'll stop sharing my screen here and see if anyone has any questions regarding the HR1 changes that are going to be taking place.